Drinking alcohol is a leading cause of premature and preventable deaths. Two main measures are used to estimate the number of deaths caused by alcohol consumption: alcohol-specific deaths and alcohol-related deaths. Both definitions are used by World Health Organization member countries for clinical, epidemiological and health management purposes, such as for researching alcohol harm or for death certificates. The alcohol death rate for both metrics is also measured. All death rates are age standardised, as this allows for comparisons across geographical areas by controlling for differences in the age structure of local populations. Alcohol-specific deaths are deaths from conditions caused entirely or exclusively by alcohol consumption, for example, alcohol-related liver disease. This definition primarily covers long-term conditions associated with alcohol consumption and also includes deaths from alcohol poisoning. However, it excludes other external causes of death, such as road traffic accidents or other injuries, even when alcohol is a contributing factor. The majority of alcohol-specific deaths, around 3/4, are caused by alcohol-related liver disease, a condition that develops after years of heavy alcohol consumption. Research suggests that the risk of developing this disease does not increase gradually, but instead accelerates the more a person drinks over time. As a result, alcohol-specific deaths mainly reflect the effects of long-term, heavy alcohol consumption rather than lower or moderate drinking patterns. The alcohol-related liver disease that accounts for most of these deaths is best understood as acute on chronic. While it takes several years of heavy drinking to develop, a person's recent patterns of alcohol consumption play a major role in determining if and when they die from the condition. Alcohol-specific deaths are the best way to compare mortality trends over time and the best comparator between geographical areas. By only including deaths from conditions that are solely caused by alcohol consumption, a consistent measure of mortality exists, allowing for reliable comparison over time and across government agencies and departments. However, since this definition excludes diseases that are linked to risk factors other than alcohol, it significantly underestimates the number of deaths caused by alcohol consumption. Alcohol-related deaths refer to all deaths where alcohol is a contributing factor. This includes alcohol-specific deaths, but also deaths from conditions that are partly, not solely, caused by alcohol, such as cancer and heart disease. These deaths are calculated using alcohol attributable fractions, which estimate how much alcohol contributes to each condition based on the latest research. Alcohol-related death figures are then calculated using the latest data on the risk of each disease, combined with the level of drinking across a population. For example, in England in 2023, there were 8,274 alcohol-specific deaths, mostly from alcohol-related liver disease, mental and behavioural disorders caused by alcohol, and alcohol poisoning. Yet there were an estimated 22,644 alcohol-related deaths, which will include the specific deaths, but will also include deaths from alcohol-related cancers, heart disease, and other causes. By tracking alcohol-related deaths, we're able to capture a broader scope of alcohol-related harm than the one covered by alcohol-specific deaths only.